Thank you, all of you, for being here, and welcome again to our update seminars. And we will, as I said, try and give you an overview of what is happening worldwide first. So certainly COVID-19 is behaving in a very different way in different parts of the world. It is acting as a multi-system stress test. It is affecting many, many different sectors of society. And of course, this is linked to the virus itself, but also to the population, which is affected by that virus, but also to the diagnostic capacities, the surveillance capacity, and also the capacities of treating patients in the different countries. So just to give you numbers on where we are, we have had over 202 million confirmed cases worldwide. There have been actually over 4 million deaths, and these are, of course, the reported deaths, and the 202 million are the reported cases. And to date, we have administered 4 billion doses of vaccine worldwide. But we will hear more about this and about how the vaccine has been distributed later in my talk. So this slide, which was issued by the WHO, I think is quite interesting and useful because it shows how COVID-19 has impacted different areas of the world. And the histograms in yellow and dark yellow refer to the Americas. And certainly in the Americas, there have been a significant number of cases. And you can see that overall, the number of outbreaks and the cases, as they evolve, they have they are clearly in a biphasic. So there have been 2 waves, and now we are facing the Delta wave or the 3rd wave. But I would like to point out, as I pointed out, the Americas, this little blue histogram here, this little blue square. So actually that is Africa. And I think that because UF, there is a very well-developed Center for African Studies, and we study what is happening there. I think that this is something that we should notice, that we should be careful about, and that we should be attentive to, because of course the numbers are not the numbers that we see in this graph, but this is clearly an underestimation. Now, we are all fearful about the Delta variant, and the Delta variant is, of course, widespread in most of the world. It is behaving in a different way from the wild type virus. It may cause more severe cases, but this is still under investigation. We are seeing infections in a proportion of people who are vaccinated, and this is happening worldwide. We know that vaccinated people who get infected with Delta can spread the virus, but of course they spread the virus less than people who are not vaccinated, at least at a population level. And what we are seeing is that vaccinated individuals may actually even have a clinical disease. They may show clinical symptoms. And but what we are seeing is that those clinical symptoms are never particularly severe unless they are in non-vaccinated individuals. Now, I thought I would mention what is happening in South America, also because at UF we have a very well-developed Center for Latin American Studies, and And COVID is raging in South America. There are several variants which are emerging, and the healthcare system we know is weak, and the governments have been weak in controlling infection, and cases are really surging, particularly in Brazil. Brazil continues to have one of the worst records on COVID. The observed case fatality ratio is very high, and the situation, of course, in the country is very severe. Mexico is also seeing an increase in cases, and this is complicating further the reopening plans for the US-Mexico border. So this is just one of the examples of how many ramifications an event of this magnitude can have. And also Cuba has shown a surge in cases, and unfortunately, there's a low proportion of the population which has been vaccinated, and this is contributing to the increase of cases. Now, I said I would mention a few things about Africa, and of course, Africa is a very big place, and it's very difficult to summarize things in a few slides. But there has been a third wave of infections in Africa. Of course, the Delta variant has spread through Africa, but we know that Africa has also been a source of other variants, like the Beta variant, which emerged in South Africa, and so the uncontrolled a circulation of virus in such a large territory, which is vastly unvaccinated, because it appears that just 5% of the doses that have been administered until now have reached Africa. And therefore, this is, I would say, it is certainly going to give us problems in the future, because the more the virus circulates in naive populations, the greater the risk of variants emerging. Now, Costanza Manes from my team did a hunt of news on what is being reported in Africa. And you will see from this slide that we go from Tunisia mentioning that there is a catastrophic situation and this health service is collapsing, to other situations in which actually members of government are affected. You might remember that in Tanzania, the prime minister died some time ago. In Uganda, we have 160 senior government officials which have tested positive. Other African countries are seeing the raise in cases and the increase in the number of cases skyrocketing, and of course, saturating the healthcare facilities which they have, which, as we know, are never dimensioned, are never sufficient for all the problems they have in that continent. Okay, so let's move to Europe. Europe has now about 50% of the population which is fully vaccinated, but we'll see in another slide that this is not an even distribution. Similarly to what is happening in the US, in which not all states are vaccinating in a similar way, the same thing is happening in Europe, where some of the countries are actually pushing for vaccination, but other countries, particularly the ones towards the east, are not as good. Europe is looking, actually the UK has reopened the borders. You don't have to quarantine or self-isolate, but still moving particularly into the UK, which is where I am now, is extremely complicated. I can tell you by personal experience, there's queues and queues and queues to get into the UK. Other countries in Europe, because the UK is not longer within the European Union, have issued these vaccine passes for their residents, which basically give the people who have these passes rights to be present in certain spaces which they wouldn't be entitled to be at unless they were vaccinating. And this, of course, is creating great havoc and irritation. Now, in Europe, President Macron was the first one to establish this virus pass on July 20th. And this pass is used to enter all restaurants, public transport, and other public venues. And President Macron has been pushing for mandatory vaccination in health workers. However, as it often happens, particularly in France, where they're very good at protesting, there have been some very serious protests around the issue of mandating vaccination, also for children over 12. As I mentioned earlier, if you look at this map of Europe, you will see that the countries towards the east, towards Russia, are the countries that have had the lowest vaccine uptake. And this makes Europe a territory which is not protected similarly all over its territory. And this makes things more complicated for moving around Europe and to establish rules and uniform and harmonize those rules across the Union. Now, the Delta variant has already also affected Europe. It is actually has been detected significantly in the UK. You may remember that the Delta variant is a variant that emerged from India. And of course, there is a lot of connection between India and the UK. And from the UK or from India, it has most likely spread to many, many European countries. However, I have to say that compared to the US, in some European countries, the Delta variant is still not particularly prevalent. Certainly, as I am sure Sonja Rasmussen will tell you later, it is important to keep this variant, I would say, under control and below its the level at which it becomes very, very dangerous. We just need to maintain high vaccination coverage. Okay, let me just move a little bit on vaccination, but I would, because Sonja Rasmussen will speak a lot about this and also about vaccination in children, I would like to mention these two terms that are being used a lot and that maybe are not very clear to all of our lay audience. And as we experience the largest and most challenging vaccination campaign that mankind has ever had to manage, we realize that we have two different sets of data. And these different sets of data are data on vaccine efficacy, which means how the vaccine performed under ideal conditions in clinical trials. But we are now talking about vaccine effectiveness. What does this mean? It means how does the vaccine perform in wider populations? And that's really what is interesting to us. We need to know that vaccines are safe, and we know because of all the trials that are done under controlled conditions. But we also need to be aware that vaccines that are tested in the lab behave or in under controlled conditions may show different outcomes when you look at them in the field. And particularly when you have a new variant like the Delta variant. The Delta variant is going to change the effectiveness compared to the efficacy that was tested under controlled conditions. However, the CDC is working actively on trying to understand the cases of breakthroughs, what type of breakthroughs we have, and will continue to provide us and give us guidance on how to move forward. I thought I would say a few words on vaccine hesitancy, because this seems to be an enormous problem. And if you look at the dynamics of the world and how the virus is ripping through countries which do not have access to vaccine, it does seem very frustrating that in developed countries we do have access to vaccine and we're not using it properly. And certainly, I think that the noise that has been around vaccines and vaccination and the evolving situation, because this is an evolving situation, things are changing, and they're changing all the time, and therefore things that we say today may not be necessarily true in 6 or 8 weeks' time. Prior to the emergence of the Delta variant, we were seeing not many cases of clinical disease in vaccinated individuals. Now this is happening. And so clearly for people who do not understand the complexity of vaccination and of the immune response, this can be very confusing. However, this problem lies on the back, or rides on the back, of an anti-vaccine sentiment which has been around for a while. And this is a study that was conducted prior to COVID-19, and you will see that there are, in countries like in France, 1 out of 3 don't think that vaccines are safe, and 1 out of 10 don't think that children should get vaccinated. In Ukraine, similarly, 50% of the population doesn't believe that vaccines are safe, while in developing countries, instead, they would like to have vaccine, and they would probably use vaccine if they only had access to it. Certainly, there is a push to create confusion around vaccines and actually actively convince people not to get vaccinated. And I have actually bumped into a couple of Novax campaigns and Novax public events in my trip in Europe. And I have to say that they are quite scary if you listen to what they say. And actually, from a study that was, or an investigation that was performed, it turned out that misinformation about vaccines is being pushed by very few people around the world. And this shows you the power of social media. There are influencers who are influencing people to fight for their freedom of not getting vaccinated, with all sorts of stories behind this. And this basically has a domino effect, a sort of contagion effect, and is creating, I think, enormous amounts of problems that I think will be very, very difficult to solve. As I mentioned earlier, in Europe, we are seeing these COVID passports that are being used as a way to push also people towards getting vaccinated. But of course, this is spurring up a lot of irritation, because people think that their freedom is put at risk and that they will be discriminated if they don't want to get a vaccine. And certainly, you are free not to get a vaccine at the moment. And of course, this is an individual liberty, but it does make sense that if you don't get a vaccine to protect the health of you and other people, you will have to stay away from certain initiatives. At least this is what is being pushed in Europe. But as One Health Center has always said, science is one part of the solution, but making people understand the complexity and engaging people into public health is extremely important. So I would like to congratulate Jill Sonke, who is a member of UF faculty, who is working now at the CDC in finding, she is actually the director of the Arts and Medicine program, which we've been working with for a long time. And she will actually she is working at CDC to build new ways to engage people with the importance of being vaccinated through other ways of communicating arts and exhibitions and other ways. I think that this is an extremely important component of managing a pandemic like this, and would like to thank and congratulate Jill Sonke again. Now, of course, we have seen the Tokyo Olympics, and the Tokyo Olympics have been very, very challenging. Tokyo 2020, which actually, of course, happened in 2021. This, on one hand, was an enormous effort for the Japanese. They tested many samples and found actually in the Olympic bubble a low number of athletes and of staff who were positive. However, of course, because this is a multi-system stress test, there have been lots of protests against protecting the health of Japanese because some citizens have been fearful that the Olympics might bring more COVID into Japan and therefore cause a surge of the number of cases. Now the fear is, of course, that the Delta variant spreads rapidly as well into Japan as well. Now, a few words on animals. There are not a lot of updates in that we don't have new species that have been affected. There are studies that are ongoing on several animal species. Some groups are looking into pets, and here you see we are reporting there's a study in which swabs have been taken from 310 pets in 196 households, in which there was an infected humans, and 4.2 show some evidence of infection, and 17.4 tested positive for antibodies. So the general recommendation is that if you have COVID, just bear in mind that your pet could also catch COVID, and so act with your pet as you act with your human friends, remembering that after all, humans are animals and therefore they belong in the same box as animals. Now, there has been also, let's say, more research that has been generated on vaccinating animals. And in some parts, even here in some countries, and even here in the US, they have started vaccinating large animals like lions and tigers and bears. And at the moment, they are trying to work out how to do it. But in other parts of the world, like actually in Wisconsin, but also in Russia, animals are being vaccinated, particularly minks, because we know that mustelids, like minks, are susceptible to infection. And some of these minks are farmed of course, in captive conditions, and because of their fur. And this is quite a big industry. It was a big industry in Europe, which has been crippled by, of course, the COVID-19. You might remember Denmark and the Netherlands had outbreak in mink. And actually, there is a US bill that has been introduced, which has been proposed in July, which basically wants to prohibit the import, export, transport, sale, or purchase of mink into the US. And so this would be something that is following what happened in Europe, in which these mink farms were closed before time, because there was going to be a ban on mink farming coming into place in 2 or 3 years in Europe anyway. And this is what is happening in Russia. In Russia, they developed this Carnivac vaccine, which is a vaccine for animals. They're using it in dogs, cats, foxes, and mink. And we will see where this takes us. With this, I have one word of mention, and thank you to our veterinary colleagues for asking us. Yeah, there is this legend that a drug which is used for fighting parasitic diseases in animals mainly, which is called Ivermectin, is effective against COVID-19. I will just say that there's a statement from Merck that produces the drug of February, saying that this drug, there is no evidence that this drug works against COVID-19. But what is happening is that this is creating a shortage of the drug. The request, let's say, the necessity of using this drug for human treatment of COVID, which does not make sense because it is not substantiated. And Sonja Rasmussen will also touch on this, is causing a shortage in veterinary drugs. And so once again, you see how pervasive this issue is, and the multiple ramifications that a pandemic can have, even on areas or in species which may not even be affected directly by the disease, but certainly this drug is used a lot in horses, and therefore, even if horses are not susceptible to COVID, here is one of the ramification domino effects of the pandemic, which affects the health of horses. And with this, I would like to tell you that the One Health team is back at work. We are looking forward to our fall semester. We are encouraging using masks and other precautions in this moment, which is a moment, a critical moment, I think, particularly for Florida, for our students and for our staff. And so at the UF Center, we will be wearing our masks all the time. And with this, I think this takes me to my last slide, and I will most happily pass the floor to Sonja Rasmussen, who will start her presentation. So thank you very much.
Great. It's nice to see you all again. I have to admit, when we met last time, I was hoping that we were nearing the end of these, but I'm disappointed. I enjoy doing them, but I'm disappointed that the reason why we're back and having even more concern in some ways, I'm even more concerned than I've ever been, especially about kids who can't be vaccinated. So I'm going to give you an update on COVID-19 in the United States, and then some of the science behind some of the headlines that you've been hearing recently. So first of all, updates on the COVID-19 epidemiology in the United States. Here you can see numbers are really very rapidly. And remember, this is exponential growth that we've seen before. And with the Delta variant, the exponential growth is even more than what we've seen before, because if you remember before, the R0, the reproduction number for the original virus, was somewhere between 2 and 3. So one person on average gave the virus to 2 or 3 others. This Delta variant, the the estimates right now are 6 to 8. So one person gives it to 6 to 8 people. So if you say one person gives it to 6 people, those 6 people give it to 6 more, right away you have 36. You can see how quickly the numbers are really going to get up there. And we need to take this very seriously, all as individuals, and make sure that our friends know as well. So this is, I've been showing you this in the past, and you could see in the past, we had just a little bit of Delta variant, that darker orange. And what you're seeing now, almost everything in the United States is the Delta variant. More than 90% of the viruses tested are the Delta variant. And as I said, it appears that it's much more contagious. Whether it's more severe, I think is still we don't know for sure. So there's been a couple studies that say that people who have the Delta variant are about twice as likely to be hospitalized. But, and certainly what we're seeing in different children's hospitals across the United States is lots and lots of kids being admitted. Does that mean that Delta variant hits kids harder? I don't think we have that information right now, but certainly it's very concerning. And you can see how it really has pushed out pretty much all the other variants. So this is what Delta variant looks like in different places in the United States. You can see in the Southeast, it's really a very high amount. Same here, a little bit less in the Midwest. And these are trends in hospitalizations. I hear people saying, well, what's the big deal? You know, you get virus in your nose, it's not that big of a deal, but clearly you can see the increase in the hospitalizations is pretty impressive. So you can see why somebody told me Good Morning America was outside Shands this morning. I saw they were in one of the ICUs on ABC News last night. So you can see that really lots and lots of hospitalizations, and really Florida is a hot spot right now. And then again, I keep hearing people say, well, but we've protected the old people aren't dying. You can see it isn't, remember every time before, we've been through this before, the deaths always lag. So the cases go up first, then the hospitalizations go up, then the deaths come up. And so we're just starting, you see, we had gotten down to a pretty low number of deaths, and we're starting to increase deaths again. So even though I think a lot of the older population is vaccinated, there are younger people who are dying, and certainly that's what we're all hearing on the news too. So I want to talk a little bit about vaccination progress, and the bottom line is it's kind of stalled. For a while, we were going like gangbusters, more and more people getting vaccinated. And as we've talked in the past, there's a group of people that were dying to get vaccinated. They were sitting, hovering over their computer the minute that they could get one. Then there were people that say, I'm never going to get one unless you drag me in to get it. That seems to be about 10 to 20%. And then there are a lot of people in the middle that just want to hear more. And I don't want to sound too much like a preacher, but I do want to say that all of us can play a role. When people hear from friends, that's where they're most likely, friends or their physician are people that are most likely to convince them to get vaccinated. So, you know, if you have friends that are saying that they still haven't been vaccinated, tell them what you know about the safety of the vaccine. And I think the bottom line right now is, your choice right now is to get the vaccine or to get the Delta variant. The Delta variant is so infectious that if you're anywhere outside, if you're outside of your home, you're very likely to get it. It's going to be tough to not get it. And that's the other thing is, keep in mind that there are children who can't get the vaccine, under 12 still can't get the vaccine. So our way of protecting kids, in addition to masking in schools, is to get everyone else vaccinated until, and I'm hopeful that vaccine will be available for kids soon. So here's those numbers. You can see the peak was in around April, and then there was a sharp drop off. I think people started seeing that the numbers were going down. Why do I need to bother getting vaccinated? And then just the last couple of weeks, there started to be a slight increase in people saying, wow, this is looking pretty serious. Maybe I should get vaccinated. So again, if there's people that are in that range, I think there are some people that we might never be able to convince, but people who are in the range that they're thinking about it, help to give them the information, or I'm happy to talk to anybody about it if you have questions. So this is the number. So percent of the total population that's had at least one dose is about 59%. I took this off right actually while Ilaria was talking, because they update it every day. It's updated by 8 p.m. You can see the numbers people are saying about adults. Remember, the goal was to have 70% by July 4th. It was about a month late that they hit 70%, and right now 71% of adults 18 years and older. If you take everyone that is eligible, about 69%. And then people greater than 65 years of age, the numbers are high, 90.6%. And getting both doses, being fully vaccinated, 80%. So I want to talk a little bit of some of the headlines that we've seen about vaccines. One is this paper, and this talks about breakthrough infections, and we've always known that no vaccine is 100% and that there will be some breakthrough infections. We know from the start it was about 94% effective. This is some data from Israel, and here you can see out of almost 1,500 fully vaccinated healthcare workers, there were about 39 who had breakthrough infections with SARS-CoV-2. This was of the Alpha variant, not the Delta variant. 27 were tested not because they felt sick, but because they were part of an exposure investigation. They did test antibody titers. They were testing antibody titers all along, and they did show that the people who were infected did have lower antibody titers. So it seems like some people are not, and that may be helpful to us in the future. Most breakthrough cases were mild or asymptomatic. They had a kind of a runny nose, stuffy nose, muscle aches, loss of smell or taste, or fever, and none of them required hospitalization. But I think this last point is the one that makes me think, what has really convinced me that I am back to being very careful and putting my mask back on in any sort of situation where I'm around others, is that 19% had persistent symptoms, what we're calling long COVID, prolonged loss of smell, persistent cough, fatigue, weakness, dyspnea, or myalgia. So, none of us want long COVID. Even if you're vaccinated, you might not end up in the hospital or die, but you could get long COVID. So I hope that will convince everybody to put their mask back on. So this is another paper that you probably heard in the news, the reduced risk of reinfection. So it looked at people in Kentucky who had had SARS-CoV-2 in 2020, and then looked at the ones that got reinfected. And they saw that the people who were vaccinated, who were unvaccinated, were about 2.5 times more likely to be reinfected than those that were fully vaccinated. So again, I keep hearing people say, well, I'm not going to get vaccinated because I've already had COVID. Even if you've already had COVID, there is strong evidence, and this is good evidence in people. A lot of the previous evidence was looking at antibody titers and that kind of thing, but this is good evidence in people that getting that vaccine, even if you have previously had COVID, that the vaccine provides further coverage. So these are the actual numbers. You can see these are the people that got COVID. These are the people that didn't, and you can see the odds ratio was 2.34. So you can see there's some protection from partial vaccination, because a lot of people said, well, I'm just going to get one vaccine. I'm not going to get both doses because, my getting COVID was my first dose. No, you really do need to get both doses. So I want to talk a little bit about the CDC policy change regarding masks for fully vaccinated persons. And I thought I would start with what led to that policy change. It was really this outbreak on Cape Cod. It was, there were large public gatherings on Cape Cod, lots and lots of people from all over the United States. And pretty high vaccination rate. I think there was a 75% vaccination rate. And what they found is that even some of the people that were fully vaccinated were getting infected. And then, so here you can see 79% of vaccinated patients with breakthrough infection were symptomatic. So, and for required hospitalization, there was no deaths. So, and they did show that this was almost all the Delta variant. And when they looked here, This is cycle time. So cycle time, if you have to do more cycles on a PCR, that means that the amount of virus that's there is lower. So it's sort of the opposite. A higher number means less virus. But you can see here that really the level of virus in the unvaccinated versus the fully vaccinated was pretty similar. Now we don't know, this is measuring RNA, it's not measuring if the virus was alive and could infect other people, but certainly it shows that there is similar amounts of virus in the nose of vaccinated and unvaccinated people. And that has really led people to say, it's time to put our masks back on, led CDC to say, put your mask back on when you're indoors, especially if you're in an area with high levels of spread. So this is their latest statement in areas of substantial and high transmission, which is nearly the entire United States. CDC recommends that fully vaccinated individuals wear a mask in public indoor settings to help prevent the spread of Delta and to protect others. So I want to talk a little bit about masks because I keep hearing people say masks don't work, masks work. We saw that last year. And so I'm going to start, if somebody wants to look carefully at the data on masks, this is a really nice paper published in PNAS. You know, PNAS is a very high level journal, and it says the preponderance of evidence indicates that mask wearing reduces transmissibility per contact by reducing transmission of infected respiratory particles in both lab and clinical contexts. Public mask wearing is most effective at reducing spread of the virus when compliance is high. And I think that's one of the important things. We really believe that the mask, you know, I think we've talked about this a lot if you've been to a lot of these seminars, but I wear my mask to protect you, you wear your mask to protect me. So just saying, well, you can choose to wear a mask if you want, if you're afraid, or if you're a person that lives by fear. No, we all need to wear masks to really prevent the spread of virus, according to the scientific literature. So what about masks in schools? And I just thought I would show a few of the studies that have been done. This is a study that was done in the state of Florida. Here you can see this is the Florida state epidemiologist, the Florida Surgeon General. So done in Florida from August to December of 2020, and these are the cases that they were seeing. What you can see is that some of the cases were school related. So the percent that were school related actually was relatively on the low side. But what were the factors that made a school more likely to have spread or less likely? One is the size of the population, and I think you might think this would be the opposite, but the bigger the population of the county, the lower rate of infection in the schools. Then the opening date, you remember some schools set the date of the opening back sometime last year. The schools that set their opening date back did have lower numbers. You can see the lower number here, the rate in students. And the counties that masks were mandated in the district reopening plan, if you mandated masks, you had lower rates and highly, 0.01, so definitely statistically significant. Also, they looked at full-time in-person students, and of course you'd expect that if you had more students that were in person, the rates were higher. That was a correlation. And then they also looked at, and I think this would make sense too, the county case rate. If the case rate was higher in your county, if you had more cases, then the rates in schools were higher. So this is one from Georgia. It's a similar sort of study. And this looked again at the county incidence. So once again, I don't think this is rocket science, just trying to go through the data, that the higher the incidence was in the county, the higher chance of cases in schools, of the COVID-19 incidence in schools. And then here, mask requirements were protective. So you can see this risk ratio is less than 1, and it is statistically significant. This is when there were mask requirements for teachers and staff members. This is if there's mask requirements for students, optional versus required. You can see that this is not quite statistically significant, but certainly it's well below 1. And then ventilation improvements also made a difference. So trying to improve ventilation as much as you can in the school, trying to keep a window open in rooms, keeping doors open. Unfortunately, when we talked to to the town hall on Monday night, teachers says they aren't allowed to keep their doors open because of shooters, the possibility of shooters, which seemed really sad to me. But anyway, ventilation makes a difference. So these are the factors in that study that were shown not to decrease risk: the school type, urban, rural, instructional setting, whether there was all in-person or hybrid, medical leave policies for teachers, if desks or tables were separated by greater than 6 feet. In most schools, they did try to have social distance as physical distancing of at least 3 feet, but some couldn't make 6 feet. Desks or tables with those plexiglass barriers, median number of students per classroom, median cohort size, or number of hand washing stations. Those did not make a significant difference. And this is just looking at, you don't want just dilution, air purification, and I'm not a ventilation expert. So here you can see that was lowered it, but not as much as doing dilution and filtration and plus minus purification. So these are, you want if your child is going to school, you want to try to see that the school is doing as much as possible as they can to try to improve ventilation. So here are some data. I just put the titles here rather than going through each one in the interest of time. Here you can see there were several schools last year that were able to keep the numbers very low or really very, very limited in school spread. But that was with using masks, oftentimes trying to limit the number of kids, maintaining 6 feet if possible, at least 3 feet, and then quarantining after exposures. So I've heard some stuff about masks are bad for kids. I've tried to do some searching of the literature. I have not been able to find that. There was this paper that came out in JAMA Peds about a month ago, June 30th, and it has since been retracted because the methods that were done were not considered to be acceptable methods. This is a notice of the retraction. And then certainly I heard when we went to the school board meeting last week, I heard people saying, well, masks cause mental health issues. I really wasn't able to find that either. And if some of you have those articles, I'd be happy for you to share them with me because I want to present things fairly. I did find some of these where people who were wearing their face coverings had better mental health in these two studies. But if there's studies out there that I'm missing, I'd be happy to hear it. So here is the American Academy of Pediatrics recommendations. All persons who are eligible should receive the vaccine. All students older than 2 years and all school staff should wear face masks at school. And then that multi-pronged layered approach that we've seen before: vaccination, universal masks, ventilation, testing, quarantining, and cleaning and disinfecting. This is the CDC guidance. Initially, the CDC guidance was not entirely consistent with the AAP, but now it really is. Vaccination, universal indoor masking, regardless of vaccination status, keep at least 3 feet distance, and then testing, ventilation, hand washing, stay home when sick, contact tracing, and cleaning and disinfection. So I did decide to add some slides about ivermectin, but you've already heard from Dr. Capua that don't take ivermectin. There was something on Twitter today saying somebody whose child was being given ivermectin, animal ivermectin is not safe for humans. And here you can see a news report saying it's ending up giving a shortage of something that's needed for horses, and that it's making people sick. Many people have already died after taking it due to liver toxicity. These are a couple papers just for you to see the science behind it. This is a Cochrane review. They say there's the reliable evidence available does not support the use of ivermectin for treatment or prevention of COVID-19. And then here is the NIH treatment guidelines. If you're wondering about any treatment, you can go to NIAID, NIH, and then COVID treatment guidelines, put that into Google. They'll give all of the treatment guidelines for any sort of medications. And here you can see the same thing, that they say there's insufficient evidence to recommend either for or against the use of ivermectin in the treatment of COVID-19. This is for human ivermectin, so don't use human ivermectin, but definitely don't use horse ivermectin. So remember, as Dr. Capua said, this is a rapidly changing time. You know, here we are. I think you started these in January or February of 2020, and we're still at it. And it continues to be a rapidly changing landscape. I just want to remind you guys all to keep yourself and your family safe out there. And as you can, talk to other people about the importance of being vaccinated. Because I feel like that can spread too. Just like the negative about vaccines, the anti-vaxxers can spread information. We all who know the science can spread positive information with our friends and families.